the IT professionals have about 80% of them have fatty liver.
So on one hand, we have fatty liver, which is kind of sneaky without any symptoms. And on the other hand, we have rising number of people getting affected with it.
Till you have at least 80 to 90% of your liver damaged, you will not have any symptoms whatsoever. Liver disease is a silent killer.
Fatty liver is on the rise among people who do not drink alcohol at all. I mean, is that true?
People sit with people who are drinking alcohol, not drinking alcohol, assuming that they're fine, but they're not fine.
Black coffee is supposed to reverse the damage. Is it true?
Fatty liver is reversible for sure. If you lose about 10% of your body weight, your significant amount of risk factors for fatty liver get reduced. Every organ of the body gets damaged when liver fails.
So welcome to the program, Dr. Naveen, and it's always good to have you.
Likewise, thank you for having me today.
So Dr. Naveen, can you share some insights from your incredible medical journey from India to UK and back to India? I mean, how has this experience shaped your medical profession?
I've been grateful to a lot of people for my journey that I've gone through. During my MBBS days, we had such a great teachers who actually shaped us to understand where we need to go. From the start, I was always interested in medicine. Although I was a topper in surgery and in anatomy and other branches, but my interest has always been in medicine. But I think after going to UK, the reason why I choose UK is because of the structured training program that we get over there, and then got into my training jobs, and then I was lucky. I was actually very, very lucky to get being trained by great teachers who've been my motivators, I look forward for them for everything that they've been teaching us, taught us, to be honest. So that's how I slowly got interested in gastroenterology, then liver. Then I did my liver transplant fellowship in Birmingham, which is one of the highest transplant centers in the world. And I worked as a consultant there for some time, and then I came back to India. But the reason why we came back to India is we thought we can do more kind of a service over here. I feel happy that I serve my patients, my patients around me, and getting them better. There's no happiness that we get, nothing beyond that when we actually see our patients getting better.
That's really beautiful journey, what you've mentioned. So have you ever wondered, if not for a doctor, what profession you would take up in life?
Now, if God gives me another life, I would definitely be a doctor again. Not that I don't like other professions, but I think doctor is a very noble profession where, in fact, the medical field, where you can do service to the patients and you can make impactful practice, impactful journey to their life. And people come to hospital not just to spend some time in the hospital. They don't come for a holiday. They come here because they're sick, and we are in the right place to help them out. And that's the happiness that we get. So if God gives me another life, I definitely would like to be a doctor again.
That's really, truly wonderful, and thank you. Said it beautifully. So we're here today to talk about fatty liver. It's something which is trending these days. So to begin with, what exactly do we mean by fatty liver? I mean, should we be very scared it sounds so?
Fatty liver definitely is a condition which is on rise lately. What fatty liver means is excess fat depositing or accumulating into the liver. Okay, that's what fatty liver means. And if you look at certain pockets of population, particularly in urban population, the rates of the fatty liver has been growing in alarming trends. Almost in certain populations, have 80% of the population are actually having fatty liver, particularly the IT professionals who, for whatever reasons, whether it is because sedentary lifestyle, not having any exercises, stress that they're going through, probably the targets that they have, and particularly the post-COVID, where they have become work from home, and there is no differentiation between the work and the family life or your life, personal life. And essentially it means you're working 24/7. So because of all these reasons, we see increasing number of fatty liver. In fact, there was one survey which was done recently that the IT professionals have about 80% of them have fatty liver, which is quite alarming, because this fatty liver, similar to as we know that alcohol causes damage to the liver, the fatty liver does the same amount of damage to the liver. Whatever the reasons may be, this fat, when there's excess amount of fat, when it gets accumulated into the liver, that causes inflammation. That inflammation will lead to scarring. That scarring over the course of time will lead to permanent damage to the liver, what we call cirrhosis. Now, once people reach the stage of cirrhosis, it is an irreversible condition. So it will not come back to normal. It is permanent damage to the liver. And from there, you'll start getting all the complications. Now, the other worrying part is this cirrhosis is a silent killer. Till you have at least 80 to 90% of your liver damaged, you will not have any symptoms whatsoever. Which means your fatty liver has been silently progressing, getting worse. You will not have any symptoms. And then only when it reaches the stage of cirrhosis, end stage damage, then only you have symptoms. The other problem what we're seeing is childhood obesity. People, kids particularly, we are seeing alarming increasing number of childhood obesity. Now, these kids are the ones which are our future torchbearers, our future generation. Now, if you can imagine these kids, when they get older, they become adult obesity. Okay. So we're having a big tsunami in front of us because of this fatty liver problems.
So on one hand, we have fatty liver, which is kind of sneaky without any symptoms. And on the other hand, we have rising number of people getting affected with it. So how do you know that, one is suffering with fatty liver disease? I mean, I'm sure they would look normal as ever, as anybody.
As I said, liver is a silent killer. Fatty liver is a silent killer. Unless you know about it, unless you proactively check for it, you will not know about this condition. So I would urge all the viewers to please get yourself checked regularly for fatty liver. All you need to do is simple blood test, liver function test, and also a scan called ultrasound scan, which will tell us about what is happening in the liver. But also it's important that you carry an important and healthy lifestyle, which we'll discuss subsequently, of course. But it's important that you get yourself checked that you have a fatty liver or not, because as I said, liver disease is a silent killer. Fatty liver is a silent killer. It is going to hit most of the people, particularly in India, because India being the diabetic capital of the world, we have increasing number of fatty liver cases in India.
So when we talk about liver, be it any condition or about the harmful toxins affecting the liver, I'm sure alcohol is a number one villain we usually talk about. Fatty liver is on the rise among people who do not drink alcohol at all. I mean, is that true?
Liver is such a beautiful organ. God has given such a beautiful organ that it copes to a lot of extent. Liver cells regenerate as long as there is time given and you remove the culprit from the liver point of view. Now, the common culprits, as I said, is the alcohol. Along with that, as we discussed earlier, fatty liver is one of the other bigger culprits. Along with that, viral hepatitis or viruses can cause damage to the liver. Similarly, we have got 100 different reasons why liver can get damaged. We know that alcohol damages liver, but fatty liver, as I said, also cause significant amount of damage. And if you can imagine combining your alcohol and fatty liver, it's not 1 + 1 is equal to 2.
That's a dangerous combo.
It is, isn't it? So it's not 1 + 1 is equal to 2. It becomes 22 times more aggressive damage to the liver. And on top of that, if people who have alcohol, they take a lot of snacks and other things, dry snacks and things. And people who don't even drink alcohol but sit with the people who drink alcohol, they take a lot of snacks. So they think that I'm not drinking alcohol, but yet they're consuming a lot of calories. So these calories, this excess amount of fat that gets deposited into the liver, and that's what causes the fatty liver. So it's not just only the alcohol, it is the people who sit with the alcohol, with people who are drinking alcohol, not drinking alcohol, assuming that they're fine, but they're not fine.
Another common myth is, people who are underweight or just maintain normal weight, they tend to think that, okay, my weight is within the normal range, I will not have fatty liver. The chances are very less. So is that true?
People who think they're underweight or lean, what we call, it doesn't mean that they don't have fatty liver. There is a particular entity called lean MASH. Okay, so which means lean fat. Okay, so these people are also at higher risk of developing fatty liver.
So these days, Dr. Naveen, there's a lot of information about fatty liver and also how to detox liver, especially on the internet and some videos. So is it true that we can detox our liver with some cleanses or some juices, and also black coffee is supposed to reverse the damage? Is it true?
You're quite rightly, and I'm glad that you actually raised a question, because we're seeing so many diets these days, making, and people think that they will lose weight by, like for example, the keto diet, whether it is a intermittent fasting diet and different types of diets, which I'm sure you know about them. But none of these diets are actually recommended diets if you look at from the guidelines point of view. The reason I say that is the most important thing is eating healthily is very important. Okay, and having adequate amount of calories, adequate amount of fat, carbohydrates, proteins, minerals, all of them are very important. What we call a balanced diet. The ideal diet, the best diet, what I would suggest is the Mediterranean diet. Okay, Mediterranean diet has got good amount of veggies, fruits, vegetables. When I say green leafy vegetables, spinach, for example, has got good amount of antioxidants. You have lemon, which has got citrus fruits, which has got good amount of antioxidants. Lean meat like the poultry meat, fish, those are very good for our to detox ourselves, if you had to say that word, from the fatty liver. And also, polyunsaturated fatty oils like the olive oil, and also the groundnut oil that we have. These are all good, which has got unsaturated fatty acids, which are very good for our liver.
So, do you think that fatty liver is a one-way road, or can we reverse the damage?
Until we reach the stage of cirrhosis, which is a permanent damage, as I mentioned earlier, everything else is reversible.
So, how long does it take to reach
That can
stage?
take good few years, maybe 5 years, 10 years, 15 years, depending upon the amount of insult that you're doing to your body and to your liver. Fatty liver is reversible for sure, and even significant amount of damage to the liver can also get reversed provided you remove the culprits. And all you need to do that for that is basically you need to make sure you eat, as I said, lifestyle changes, diet and exercise are the most important tested, proven treatments for fatty liver. There are no approved drugs for fatty liver yet, although there are a lot of research going on drugs. But I would not recommend any drugs right now. The only tested treatment is basically diet and exercise.
Your lifestyle modifications.
Absolutely. And what is more important is not just saying that, yes, I will do diet and I will do exercise. You should be consistent.
Correct.
Okay. Just doing for 1 week, then, binge eating one day will not help you. You should do it consistently. This should be something like as we breathe day in and out, the lifestyle changes has to be incorporated similar to that as a consistent method. And setting realistic goals. Unrealistic goals, I want to lose 10 kilos
in a week.
You're not going to achieve that, are you? Yeah. So you need to make sure that you stick to realistic goals. Being healthy and happy will get your liver in a better state.
So, having studied the liver and also the gut so closely, I'm sure you must be having some secret mantra. So, would you like to share with us what's a secret to your life or to your fitness?
See, as I've been telling, it is a lifestyle. You have to be consistent and you have to do these processes, which I told you earlier, consistently. That is the only secret mantra. And there are no kind of shortcuts or cut short methods for any of these things. And there are no medications which will actually help with all those things there. But as I keep saying, a tested, proven treatments for you all is basically having a healthy lifestyle, diet, exercise, and sleep. These are the most important things. And also, please get yourself checked regularly with just a simple blood test, liver function test, and an ultrasound scan. Another important thing is check also for hepatitis B and C viruses.
So if liver had a personality, what kind of personality do you think it would have? It would have like a chill kind of a personality, or a hardworking, or just holding grudges like holding fat?
Liver is a resilient organ. It is a robust organ. And it is one of the toughest organs in the body. And as I said earlier, it is the largest organ of the body. And it is the chemical factory of our body. So if you can imagine, it is a hardworking and robust organ. And liver is such a beautiful organ that as long as you give time for it to recover, it will regenerate. And that is a beauty why we do, for example, liver transplants where liver cells will regenerate. So that's why we love liver.
Yeah, but I don't think we should take it for granted because it has the ability to grow.
Absolutely not. The reason we say that is it copes to a certain extent till its brink. When it starts failing, it doesn't give any chance for it to recover. It will just fail and it will get worse very, very quickly. And it's an irreversible damage when it happens. So that's why, although liver is good organ, but when it gets damaged permanently, it will not recover.
So suppose if someone got diagnosed with fatty liver incidentally with an ultrasound finding, What is that number one thing that they should be doing? I mean, apart from Googling and getting panicked, what is that number one thing they should do right away?
Yeah. So if they have fatty liver, they need to obviously consult a doctor, preferably a gastroenterologist or a hepatologist, liver specialist, so that we can go through the risk factors and see who are at risk and how to actually address those risks and also modify their lifestyle and risk factors. And of course, we also assess the amount of fat in the liver. And we got beautiful machines these days called FibroScan, which tells us how much scarring has happened in the liver and how much fat. We can quantify all the fat and we can tell what are the risk factors. If you lose about 10% of your body weight, your significant amount of risk factors for fatty liver get reduced. And this fatty liver is not only limited to the liver only. People with fatty liver have much other bigger problems, like have a risk of heart attacks, strokes.
Yeah, very often we get to hear and talk about, heart health or even your brain health. But do you think there is much awareness about liver health these days as well?
Sadly not, and I'm glad you mentioned that. And again, as I said to all the viewers, we assume that liver is such a beautiful organ, it works, and that's the reason why we don't care about it. But liver, when it stops working, every other organ of the body gets damaged permanently, and unfortunately, people die because of liver problems. With it affects other organs because liver is the chemical factor of the body, and as I said, does more than 600 to 700 different functions. And liver fails, it damages the kidney, heart, brain, lungs. So every organ of the body gets damaged when liver fails. So liver health is very, very important. And also liver also connects with the gut as well. And the bacteria that are in the gut also helps in making sure your liver works very well. So there's a lot complex phenomenon, but you should keep your liver and gut healthy to have a healthy body for all of us.
I think you've connected all the dots pretty well. So thank you, Dr. Naveen. It's been an incredible, insightful discussion. So before we wrap this episode, is there any message that you would like to share with our viewers out there?
So first important thing is liver disease is a silent killer. Fatty liver is on the rise, and we are seeing significant proportion of patients with fatty liver getting liver damage permanently. So I would urge all of you to get yourself checked regularly, because fatty liver does not give any symptoms to you. It's only when you check, then you will know that you have fatty liver. Also check for hepatitis B and C, which are just simple blood tests. If you are negative for these viruses, get yourself vaccinated and get yourself checked with blood tests annually so that we can look after your liver. Liver health keeps you healthy for rest of your body. So I would urge all of you to take this seriously and get yourself checked regularly. Thank you very much.
So remember, your liver is your body's built-in filter, and keeping it healthy is easier. So move more, eat healthy, and cut down all the extra calories. And also, fatty liver is a reversible condition until a certain extent. So don't forget to tune in next week as well. Until then, take care and stay healthy. Thank you.